currently gather feedback about patients' experiences using NHS services is not ideal. Patients often have to reflect on their experiences long afterwards. Questions are very general, and responses are often limited to tick boxes. Any comments are time-consuming to process and don't get analysed, so important feedback can be missed. So we created a study to see if we could make feedback from patients and carers easier to collect, more meaningful, and more useful for improving services. Working with 2 groups of long-term service users, our study was broken into 4 parts. First, we discussed current opinions and ideas with patients, carers, and staff. Many patients and carers didn't understand why feedback was collected, how it's used, or what can be included. A lot of staff and patients felt that current questions were too general to be meaningful for improving services, and that detailed comments would be more useful if they can be properly analysed. Many staff also felt distanced from the process of getting and using feedback. But people were positive about the potential for digital methods, especially if it took pressure off staff, and as long as other options are considered to suit specific service settings and individual needs. We then developed computer programs to analyse responses given in questionnaires, a process known as text mining. This revealed some interesting information, but informal language and typing mistakes made deeper use a bit tricky. We worked with users, carers and staff to develop new feedback tools, including iPad kiosks. Finally, we tested them. Responses were mixed across different sites. Despite general positivity, lots of patients were apprehensive about using the kiosks. Most found it easy once they started, if they'd had help and encouragement, but agreed there needed to be options for those who didn't, and informal positive feedback should count too. And many felt the best way to get detailed clinical feedback was face-to-face, especially amongst people who received home visits for their mental health care. Staff thought new ways of analysing and reporting feedback gave new insights, but we didn't see any changes in service provision during the testing period. Overall, the study shows we need to improve involvement and participation, make the most of positive feedback, and ensure this feedback turns into real improvements to care. Everyone agreed that data needs to be more meaningful, with better use of informal feedback, better analysis, and better summaries and reporting. The results will be better when leading staff members are enthusiastic for changes, and help and information is available for patients and carers. So looking at the context and flexibility of feedback tools is essential for using them to improve services and patient experiences in the future.